Hi, everyone. I'm Laura Beck with the Eden Alternative, and I'm really excited to be the host for today's Eden Alternative Live show. We have a power-packed panel with us today. We're going to be talking a little bit about supporting life with dementia beyond the experience of COVID-19. So we've learned a lot over the last year and a half, and I want to be really clear that our show today isn't about, oh my gosh, it's more COVID stuff. Really what it's about is what have we learned and how do we need to be mindful of what we've learned and gleaned from the experience of the peak of the pandemic for moving forward. Because we know that our field is forever changed by this experience. So along those lines, I'd like to introduce our panel and just start off by saying hello, Jennifer Carson. Jennifer Carson is the director of the Dementia Engagement Education and Research Program at the University of Nevada at Reno. And then we have Kirsten Jacobs, Senior Director for Shared Learning Initiatives at LeadingAge. And last but not least, Dr. Al Power, award-winning author and geriatrician and international dementia thought leader. So with that, hello everyone. How you doing?
Great, thanks.
All right. Okay. So I'm just going to dive right in with the first question today. And so as life begins to open up again, we're beginning to, certainly in our country, there's certainly other countries right now that are suffering dearly. But as things feel a little more expansive now, and we have some space to reflect on what we've learned over the past year, when it comes to supporting people who live with dementia, have there been any shifts or developments that surprised you? And if so, how should we apply that new awareness to our choices and actions going forward? Who would like to take a first crack at that?
I can jump in. Thank you, Laura. Thank you for this opportunity. I think one thing that's really on my mind is this idea that we're pulled to return back to some kind of normal. I've described it as this feeling of a rubber band that's been stretched and now this desire to spring back to normal. And that is, I think, one of my biggest fears, that we spring back to this normal and don't do what we're doing today, this chance to pause and reflect and really think about what change needs to happen, because we're in a field of many strengths and a field that needs a lot of change, right? So I'd say that people living with dementia surprise us daily, and the pandemic was no different. I reached out to a number of our members just to get a sense for where their heads are right now. And one thing I heard back from Jen Wilson at Carol Woods was this surprise that folks with dementia did fine with masks in many cases, did fine with their care partners wearing masks, did fine with video conferencing. And once again, we were reminded of our tendency to underestimate the potential for learning that's inherent in everyone, including those living with dementia. So Jen said, what if we pause to think, what are the spaces where we can create more opportunities for learning? How do we think about learning as a part of overall well-being, which I thought was really, really important takeaway for us.
Love it. Absolutely. The spaces, yes. Jennifer Carson.
I'd love to build on that. And it's interesting that you bring up our wonderful friend, Jen Wilson at Carol Woods. They are a community that is 100% dementia inclusive. So no segregated living areas for people living with dementia, no locked doors. People living with dementia are supported in living where they want to live based on their healthcare needs, but not on a diagnosis of dementia. And Carol Woods is one of those communities that demonstrates how effective dementia inclusion is, even during a global pandemic, that people who are living with dementia can be supported in living in inclusive and integrated settings. And the reason why I kind of just wanted to call that out, this notion of dementia inclusion, I was reading a recent observational study that basically summarized that among people living with dementia who lived in their own homes, 7.3% were affected by COVID-19, were diagnosed with COVID-19, as compared to 72% of people living with dementia who live within congregate care settings. And we know that that was not the statistic at Carol Woods. They actually had an incredibly low COVID rate among their entire resident population. The finding of this one study, and I think it's been echoed by other researchers around the globe, is that the living in a care home was the most relevant factor for increased risk of COVID-19 infection and death. And so when I think about that, and I think about communities like Carol Woods who have fared so well, and we think about how do we apply our awareness to the future, I hope people will increasingly look at communities like Carol Woods for some inspiration about some really effective practices that not only support the inclusion of people living with dementia, but actually support quality care and really effective infection control. And so I'll pause there. I'm sure Al has a response as well.
Thanks, Jennifer. Yeah, it's great to be here. Thanks again for having me, and I agree wholeheartedly with what Kirsten and Jennifer both said. I guess I'd start my comments with just a shout out to, because one thing we've learned over the past year and a half is the amazing dedication of people who have been working in very high risk areas throughout this whole thing. We're now talking about vaccines and what percent have them and who doesn't want one and why don't they want one. But the truth is, for a better part of a year, people didn't have that option. They didn't have any good treatment options, and yet they were showing up and they were caring for people living with dementia and others. And one thing that it takes to provide good support for a person living with a diagnosis of dementia, well, two things: flexibility and creativity. And I think that we have seen a lot of that come out in the past year. I think before last year, I'm not sure if the word pivot was used outside of basketball terminology before last year, but it certainly has become the buzzword these days. And the thing that strikes me, and Jennifer and I have been talking about this a lot lately, working on a paper, that there have been, a lot of the things that affected care homes were the same everywhere: lack of PPE, the prevalence of infection in the community. Those kinds of things affected everybody: lack of testing supplies, lack of a vaccine. So what made some do better than others? And when we analyzed that, we found that many of the things that we talk about in the culture change movement were actually the big difference between outbreaks and no outbreaks. Jennifer talked about Carol Woods. There's also a great study out there that was done of the Greenhouse Project and what they've done through the pandemic. So some of the things, for example, consistent staffing. When people had to cohort their team members and they were with the same people all the time, that made a huge difference. People got to know people better. They started following their individual rhythms instead of following institutional schedules, because there were no big group activities, big group meals. So all of a sudden we're revolving around, as Joanne Rader would say, around the rhythm of the elders. And that really changed things a lot. And I will say that I have heard different experiences about how good the masks have been for people with dementia. But I would echo Kirsten in saying, when you have that consistency, when you have those relationships, that's where I've heard it has not been a big problem, because the voice, the body posture, and that person's anticipating your needs and coming in, and it's such a huge thing. Things in the structures of the building, the size of the households, all these things enter in, to the point that a study in Ontario showed that one of the highest factors for COVID mortality and outbreaks was multi-bedded rooms. And they estimated, from studying over 600 Ontario care homes, that if those homes had gone to private rooms before the pandemic, they would have saved 30% of their deaths. Wow. And so that's a huge thing. So once again, we've been talking about these things in culture change for a long time, but this really puts the pedal to the metal as far as saying, okay, the infrastructure, the operational structures were inadequate. What have we learned? And as Kirsten said, where's the education that comes from this, and what will we do moving forward?
Can I add to that, Al? I love that you brought the importance of dedicated assignments in private rooms. Another important culture change practice that I think has really helped support communities during the pandemic has been a transformational collaborative leadership style. And I think there is a very natural impulse among all of us that when there's a crisis, sometimes we may unreflectively desire more of that command and control kind of crisis response that we would imagine we would see in the military or in FEMA. But when we look within these residential care communities, and again, this is anecdotal on my behalf that I'm sharing. These are just through my conversations with my friends and colleagues in the field. But my friends who are really transformational leaders, my colleagues and friends who are authentic leaders, who are transparent leaders, the leaders who try to take in the bigger picture and really try to understand an issue from multiple and diverse perspectives and really use collaborative processes to navigate a pathway forward. I think that transformational leadership has been what has really helped support some of these communities during the pandemic. And I think that one of my concerns is that some communities may have temporarily kind of grabbed onto command and control responses because I think that that's just a pretty natural behavior for all of us, is to really seek that clarity in direction when there's a crisis. But what I'm hoping is that increasingly we can keep learning from leaders around the country and the globe who have really embraced, prior to the pandemic, that transformational leadership style, used it to navigate the pandemic, and will continue to use it to help their communities grow and thrive. And so I'm hoping that as we emerge from this pandemic, we can really shine a light on the particular leadership styles that have really helped folks deal successfully with the pandemic.
If I can piggyback two quick quotes on there, Jennifer, I love what you're saying. Transformational leader quotes. I just had the opportunity to review a new book by Dick Cateau, who's writing about the experience of AG Rhodes, wonderful Eden Alternative Associated Homes in Atlanta, and he uses the moniker of truth, transparency, and trust. And he believes that that's part of transformational leadership, and he lived that during the pandemic. The other Eden leader is Chris Cheek, who's the CEO of Centricare in Mississippi. And Jennifer and I had a conversation with him a couple of months ago. And his quote was, "Empowerment is the best infection control." And I just thought that was a really beautiful thing to say.
So what I'm hearing, listening to all of you, is that while certain things may have been a surprise in terms of dementia support and care for others, it's not such a big surprise for those of us who have been driving a person-directed path for a really long time, that we've known that these are the tools and the strategies that we need to be successful in supporting people who live with dementia. But suddenly now, it's like being forced through a Play-Doh mill, if you remember, like you're one shape on one side and another on the other end, right? I mean, that's, crises have a tendency to create those kinds of opportunities. And it sounds, like a surprise. Was it really a surprise? Well, yes, for some people it was, they finally landed in that awareness. Agreed, different perspective. Am I following you in terms of where you're going with this? Okay, good. All right, good. So love it. Always good to be affirmed, right? That the work we do does have merit and value, and there's proof that it works. So here's the next question that I want to throw out there. What major concerns do each of you have about the impact of COVID-19 on dementia care and support in particular? And what do we need to watch out for? Or what proactive steps can we take now in response to these concerns? So who would like to go first on that one?
Of course, when it comes to concerns about dementia, I'm always happy to jump in there very quickly. And of course, the biggest one that I've worked on for years is the use of psychotropic medications. And my concern is because COVID has been distressing, because isolation and quarantine have been distressing, that will be seen as a reason to give people more of these dangerous medications. And I think it really flows from how you come to see dementia, how you come to see the person with dementia, how you come to see their expressions. And when you are rooted in that traditional biomedical thinking that these are symptoms of dementia, then a person who gets distressed is going to get medicated in an inappropriate way. And we don't have a lot of statistics in the U.S. because we got kind of a pass on the reporting there for a while. But I'm concerned that our use of antipsychotics and other drugs may go up. I do know for a fact that in Canada that did happen. I do have reports from 2 provinces that had small but very significant increases in their antipsychotic use during the first year of the pandemic. So that's really probably my main concern. And it's so funny because we're all going through these stresses. And I just have to very quickly mention a talk I saw early on in the pandemic, and not to fault the presenter, because this is the mindset that most doctors have, but it was an international talk about the pandemic. And they talked about, first thing they talked about was several BPSD, symptoms of dementia that were showing up during the pandemic. And they talked about anger and agitation and anxiety. And they said that the best approach is, of course, always to try non-pharmacologic interventions first. Well, almost in the next breath, the person said, family members in the community have also exhibited a lot of stress, including anxiety, agitation, anger, and frustration. And they suggested psychosocial support. So here are 2 groups of people with the exact same reaction to a real situation, and we're seeing them like totally different animals. And that's the kind of thinking that you really have to challenge, because as Jennifer says, there's the danger, not only of command and control, but turning this into a really biomedically focused ICU. And the studies are showing us that actually, ironically, moving farther from the medical model was a better predictor of survival.
Love it. Jennifer, Kirsten?
I'll go ahead and jump in. I'm still really grappling with one issue here. If we look at all of the data, it does seem pretty evident that dementia is the deadliest underlying condition for COVID-19. And that's concerning, and I'm trying to learn more and to understand more about why dementia increases a person's risk of severe illness and death so significantly, and trying to look beyond just the diagnosis of dementia at other underlying factors, including chronic conditions. And so we understand the relationship between increased chronic conditions and increased risk of developing dementia. And one of the things that I've just been kind of grappling with and playing with in my mind a bit here is to really think about how we can better support people living with dementia in really living well and thriving with dementia, and not just focusing on dementia, but really also focusing on trying to minimize other chronic conditions. And it's so interesting to me that I don't know of any dementia self-management courses. When people are diagnosed with dementia, I think there's unfortunately a tendency for people to withdraw. I think that a lot of times people lose a sense of hope that there can be a future. And because of that loss of hope, maybe there is not as much attention focused on how to support people in living well with dementia and just living healthy, happy lives. And so I am really interested in continuing to follow this kind of inquiry about why dementia is the deadliest underlying condition for COVID-19, the role that these other chronic conditions are playing in that equation, and what we can do to effectively better support people in living with dementia and experiencing greater health and well-being, and really recognizing and honoring the role that people living with dementia can play in the promotion of their own health and well-being if they are supported by people and programs and opportunities to do so. But it is really interesting to me, this pandemic has shown us very clearly the role that chronic conditions are playing. I'm just curious what opportunities exist for people who are living with dementia to address some of these underlying chronic conditions, including dementia itself as a chronic condition.
So many threads here. I think what's on my mind is in very, very many ways connected to what both Al and Jennifer have already shared. I think in some ways it's going back to that metaphor of the rubber band and my fear of springing back and then going a little further back related to this idea of knowing that people with dementia were, based on HHS information, Medicare beneficiary data, and to Jennifer's point, 1.5 times more likely to get sick with dementia or with COVID. And if they got sick, 1.5 times more likely to die, which is really significant. So we know that. And we know also that there's this tendency towards a medical model. So we're in a state of concern and fear where our primary goal is safety and keeping people alive, understandably. So where do we go now that we've made it to a different phase in the pandemic? And how do we avoid shifting even further into a medical model because we've been so focused on keeping people alive? And I think there are examples. I know Jen Wilson's, going back to her, said we were so focused on staying safe that we weren't focused on staying healthy and on well-being. So how do we shift back into that space? Our member Live Well, who Jennifer also knows really well, was one example of an organization that strove for a thoughtful balance in the midst of the pandemic. They really focused on infection control and using tools like masks and antigen testing. And they use those tools in order to maintain a semblance of normal within the organization. So the tools were sort of the vehicle for folks continuing to eat in community, for as soon as they can getting family members in and touching and holding hands. So, and they, as of May, had no COVID cases among residents in their community, which I think goes back to what both Jennifer and Al have mentioned in terms of that grounding of culture change and person-directedness as the guide. And then how do we think about going forward and not having infection control being the lead, but really having people be the lead in what we do? And I think that's where we need to spend some time grappling.
If I can piggyback on that once, just take it a little farther. I really appreciate both Jennifer and Kirsten's comments, so I'll just respond a bit to each. First of all, Jennifer, maybe she's being modest, but she actually was part of a landmark process of peer support when she was working in Canada. And I put the link in our private chat that we can transfer over to the comments section. And that is a group of guides. They were written by us, for us, written by people with dementia, for people with dementia, about self-management, about how to manage triggers, about how to get a good diet, how to exercise. Lots of, there's 15 or 16, I think, brochures now that are available for free download from that particular website. So, and Jennifer also, as you know, if you've been reading the articles about her coming out of UNR, has been leading some wonderful peer support online groups too, help co-facilitating with a couple of people living with dementia. And so they're out there, but we need to make people more aware of them, because I think, as you say, it's not the default of a physician who diagnoses somebody to have these things at her or his disposal to hand to somebody and say, here's a great resource. And so I think that's really important. And to Kirsten's point, we found that quarantine and isolation had its own morbidity or mortality. We saw the depression and the loneliness. We saw people getting sicker. We saw people with dementia, once again, declining more quickly than they had been. And so we know that risk is not just a one-sided coin, that you can't just say, okay, we're going to prevent infection and that will keep people safe, because a lot of people did worse based on what we did to prevent infection. So I think that challenges us all to put some nuance into policy, regulations, and into our practice too. And I know that some of the medical pundits like Dr. David Grabowski, Dr. Jason Karlowicz had been writing and speaking, saying we need a balance here between infection control and quality of life. And I hope going forward, we will recognize that really important need for balance that Kirsten talks about. That's what culture change is. It's about balancing one thing with another. It's about quality of life and quality of care. It's about negotiating risk. Those are all the things we teach, right? Those are the things that Eden teaches. And life is complex. There's no simple unidimensional answer to an infection or anything else.
You know, building on that, Al, I've been reading about effective leadership within crisis situations, and also thinking about COVID. And if you look at the research, some of the most effective emergency response plans are logical, and that's important, but also flexible and adaptive. And I think that's what person and relationship-centered practices support leaders and teams in doing, is working together to develop responses that are logical. But then after that logic has been laid out clearly, plans still need to be flexible and adaptive. It's you know, we're human beings, and we provide care and support to human beings. You know, we're not inanimate objects on an assembly line. We're not cells in a petri dish. And so having a level of flexibility and adaptiveness is just essential in terms of being able to address the situation in an effective manner that really honors the personhood and autonomy and rights of each person. And so I hope that increasingly the field will continue to work toward that type of culture, a transformational culture, a culture that's really driven with person and relationship-centered values at its core.
So I love every comment each of you has made, and it gives a really powerful perspective of the macro when we're thinking about, okay, how do we go forward in supporting the people who live with dementia? And for the people in the crowd, or the people who might be listening later when this recording is available, who are, you know, I don't know quite how to get started. You know, what's that next right step from right now? If there was like one proactive suggestion you would be willing to offer to the people who are looking more through the micro right now, where should they start, given what you've just shared, which every bit of it is, it's quite a landscape and it's powerful, but where to begin? How do you feel about offering something along those lines?
Whenever you ask me about advice, I always go to the best teachers I have, who are the people who have lived with the diagnosis. And one of my best teachers was the late Dr. Richard Taylor, who lived with Alzheimer's for about 15 years. And I remember visiting him at his house not long before he died. And at that time, it wasn't clear that he was that close to death, but I asked him what his latest charge was. And he said, he thought for a moment, and he said, I think it's to help people see the humanness of people living with dementia. And he said, the more people progress with dementia, the greater their humanity increases. And that's such a counterintuitive thing for what the common stigmas are about dementia. And I think, so that leads me to say, we really need to work on our empathy. We really need to work to understanding what connects us. We are so much more like people with the most advanced dementia than we are different. And we can understand people's responses and their needs better if we stop looking at them as this diseased other, and instead look at them as somebody who's like us, who has a different ability. And how would we feel? And it seems simple, and yet it's so hard, I have found, in education, to get people to really conceptualize, to put themselves in that place and say, would I want a locked door? Would I want a double room? It's very hard to get people to do that. And I think we really have to work at that. And I am open to any tips anyone can share with me on better ways to build empathy, because it's a tough thing.
Love it. Anyone else?
Proactive. Related to that idea is doing exactly what Al did, and I know Jennifer and I do as well, and that's asking the people in your community, whatever it may be, what the next steps are. So that pause, and then returning to the source of the wisdom within your community to discover a path forward.
I love what Kirsten and Al are sharing here. And when I remember I was part of LeadingAge's Leadership Academy and had the opportunity to learn from a leadership master, Judy Brown, who taught me so much about embracing complexity as a leader. And when I think about words of encouragement for organizations who want to know, where do we begin this journey of, shifting from command and control to something that's more collaborative and transformational. I think it was from Judy who I learned that there are two incredible tools that we have at our disposal. Number one is relationships. To really complexity if you want to deal with some complex situation, whether it's a pandemic or inclusive dementia support, which is also complex, or just providing care and support within congregate settings is just complex on its own. That the two things that we really need to embrace and help foster: relationships and communication. and that's what we're talking about: developing relationships, having empathy for one another, and honoring one another. And there are practices that can help support us in fostering relationships within a community, practices like dedicated assignments. That's a practice that can really help support effective relationships. And then a really effective channel for communication. How are you going to come together to talk and to make decisions that are the best decisions for your particular community or this particular individual at this particular point in time, knowing how important it is that we find adaptive and flexible ways of supporting each other. And so if organizations, if leaders within organizations and team members within organizations really focus, I think, on fostering genuine relationships, deep relationships with one another, respectful relationships, and they really look at building those effective vehicles for communication within the organization, I really do believe that those two tools can really help an organization grapple with whatever happens to come our way.
Well, and I love how your recommendation dovetails so beautifully with what Al and Kirsten brought up along the lines of, yeah, let's take the questions to our teams, most importantly, that individual who lives with dementia, who is a member of that team, and having some specific skills and strategies, like you say, yeah, you really can't lose going forward. It's definitely powerful toolkit. I know too that this seems like such a ripe time for people to be developing their empathetic response, based on the fact that for the first time in a long time, some of us who, and I'll say I'm one of them, like I've been talking and teaching about loneliness, helplessness, and boredom for 18 years, but living through that experience, it was a visceral experience of those three things that, wow, I felt really transformed by that. So this is such an opportunity for people to, when they're still close to remembering what those experiences felt like on a personal level, to be able to amp up and develop their empathetic response and to pair them up with some really cool tools. So thank you. Yeah.
I'm laughing because I was on a call with the Dementia Action Alliance board last year, about this time last year. And I remember Karen Love, the executive director, making a comment about now that we're all homebound. And I thought, wow, we always talk about homebound elders, and here we are, we're all homebound. And I love any connection where you can kind of say, oh, this must be what it's like. Because you're right, when it's fresh like that, Laura, this is the time for learning, and I hope we don't squander it.
Yeah, perfectly Perfectly stated. So this is kind of a great segue to the next question, honestly, because what we just pointed out is essentially a strength we can build on, right? That we have this new awareness, this kind of cellular level understanding of something that maybe we didn't quite totally feel in a deep way before. Here's the question. What strengths do you see emerging now that you think we should build on in terms of dementia support and care? Who would like to go first?
I'll go ahead and start. Well, first, I think it is helpful that there does seem to be a much stronger national and even global focus on the experiences of older adults, and a strong focus on the impact of social isolation and loneliness. And so I'm grateful that there seems to be increased focus on something that all of us have been aware of, that these were pandemics prior to the COVID pandemic. And so I'm grateful that there's so much light on the subject of social isolation and loneliness. And because of that, I'm excited to see, I guess, we've had this technological transformation over the last 16 months where life is all happening right here on these screens. But the opportunity in that has been an opportunity to gather with advocates across the entire globe to address issues that affect us all. And so I think one of the strengths that's emerging from this pandemic is this new global community of dementia rights advocates. And one of the examples I'd love to share with people in case they haven't heard about it yet, specifically to address social justice issues during the COVID pandemic, a bunch of advocates across the globe gathered together to form a new coalition called Reimagining Dementia, a creative coalition for justice, really looking at the disproportionate impact of COVID on the lives of older adults and people living with dementia in particular, and really looking at the role care practices have been playing in that increased mortality rate. And so across the globe now, there's, very quickly, when Reimagining Dementia was launched as a virtual coalition, it now has over 450 members across the globe who are working together to address these issues and to create a better and more just future for people who are living with dementia and care partners. And so that's really been a strength. How wonderful that this group of advocates have found one another, and how wonderful that so many people living with dementia are both leaders within this coalition as well as members and working together across the globe. I'm really optimistic that we may be able to really move the needle. And so thank you. I see there's a link here to the call to action from Reimagining Dementia. It's open for anyone who is interested in joining. One of the things that does make this coalition special is our focus on creativity is a really powerful resource we have in the promotion of social justice. But it's just been an incredible experience for me to be a part of this very powerful coalition. And it also kind of points to a second strength I'd just like to mention briefly, which is this proliferation of online virtual communities engaging people living with dementia and family care partners. I've been really encouraged to see so many different opportunities emerge that are bringing people living with dementia and family care partners together with other professional care partners and advocates to have really meaningful conversations about how to support one another and how we might all live well. And And so I think that's been incredible. It's challenging that we're stuck online, but I've been really encouraged to see the new programs and innovations that have been developed in partnership with people living with dementia during this time. And I hope those programs just continue to grow. And I imagine they will.
Any other strengths that people want to highlight?
If I can just piggyback on coalitions, there's a couple more I've popped that will come up in the box. The Reimagined Dementia is an amazing coalition. We also have in the US and Canada the Dementia Action Alliance, which is a group of people living with dementia and people who support them together. And there are a lot of podcasts and peer group support groups, et cetera. And another big international one is Dementia Alliance International, which is actually formed by, and its entire membership is just people living with a diagnosis of dementia, although they involve everybody else on webinars and events, but they really are a major force for advocacy and rights. And then many of the countries have their own groups. So there's Dementia Advocacy Canada, there's the Scottish Dementia Working Group. There are lots of regional groups as well. So I really encourage people to take control and not just be defined by but what other people think about you and your dementia, but to really find out how you can be involved and how you can be supported in the way you need to in order to live optimally. And so, yeah, I guess I would go along with that as well. I'll turn it over to Kirsten.
Thank you. I think I would love to sit in this place of social justice and think about this moment that we're in. And we're talking about the COVID-19 pandemic, but we're in the midst of a long overdue reckoning around racism in our country. So thinking about how that relates to living with dementia and the work we do, and holding on to the idea of intersectionality as we do this work. So looking at the layers of oppression that a person may experience in their life. And I think that's people living with dementia, and I think that's the care partners that are supporting them as well, certainly those working in community and those working within homes. So if we were to think about a strength or an opportunity of this moment, it seems our increased awareness may allow for us to do better with what we know. So how do we look at the multiple identities that everyone that we work with carries and how that's impacting their lived experience? I think is a part of person directedness, a part of what we're talking about is the true knowing of the individual and understanding the forces that are at play in their lives. So I think that's been on my mind a lot in this moment.
So I absolutely love that you bring that up, Kirsten, because we've been talking for a long time about knowing each person well, haven't we? And we have a lot of work to do around really weaving in our awareness of intersectionality as an important part of that process. We don't just stop short of taking those extra steps that are incredibly crucial and important. Any other strengths that come up as we talk about building coalitions and connecting across the miles and leveraging activism and advocacy?
Just to go back to some comments I made early on about what we found were risk factors, I think this is kind of a golden moment for the culture change movement to be heard, if they're going to be heard. And I always worry about, I'm a little pessimistic about political will, but I do believe that we have a voice that we haven't had before. And we have some more traditional mainstream physicians and academics who are talking about this, who maybe didn't talk about this a few years ago. I think the Greenhouse study, which is the one published study that really shows some striking evidence for culture change, is turning a lot of heads for a good reason. And once again, they have many philosophies and practices in common with Eden and many other culture change pathways. And so, if you wanted to campaign for dedicated staffing, if you wanted to campaign for private rooms, if you wanted to campaign for small households, or for versatile workers, for better pay and benefits for our workers, boy, this is the time maybe to get someone to listen to us. So I think we also need to have a coalition of advocacy and activism that really takes this to the people that have designed our long-term care community and say, you know what, We did this in 65 with Medicare. We did it again in 87. It's been 45 years. It's time to do it again. We need to reimagine long-term care and aged care and elder care in general. I mean, I know David Grabowski and I have talked about the wall between home-based care and long-term care, and why is there a wall, and why can't we make that more porous and more seamless, and why do we have to have such rigid silos, not only in departments, but in how we care for our aging elders?
Mhm.
I'm hoping there seems to be a widespread recognition finally that our care partners are heroes.
Yes.
And so that is wonderful. Thank goodness there is finally this recognition. They've always been heroes. And I think it's time that we create jobs and opportunities that honor the heroes among us and the heroes we want to recruit into the field. We need jobs that are reflective of the amazing individuals who are working in these positions. And so I'm grateful that there seems to be greater recognition of the importance of employee care partners and family care partners, and as being healthcare heroes or just heroes in general. But I think we now need to align our processes and our policies accordingly. And so we have a lot of work to do in that area. And I hope that we seize on this time to make those improvements.
All right. Rich strengths conversation. And that conversation is going to dovetail beautifully into our last question today, where we actually get to hear stories about success and building on strengths. And I'm curious if you have any specific success stories from the past year in particular that might inspire and renew commitment to person-directed, relationship-centered dementia care practices. Would love to hear some specific stories that people feel like they can put in their back pocket and use it as go juice for making the changes they want to make.
I'll jump in to get us started because I think there are so many stories and so many examples of resilience that we've already talked about. But one of the stories that stuck out to me was from Mariah Bernhardt at Christian Living Communities, where our friend Jill Vitale Awesome is now. But she shared in one of their Denver communities when the team members were getting a sense that things were not looking good. So this would have been March of last year. They opted to bring people, residents and team members together right away for a learning circle. So it felt scary because there were so many unknowns at that time. And in some ways it was bringing up fears that perhaps didn't yet exist, but these team members were really confident that they needed to prepare and start getting a sense for what people wanted, what was important to people. And to give a sense of agency at a time, there was very little agency among really all of us, but particularly people living with dementia. So she talked about that coming together initially, and then the team members and the community continuing that throughout the pandemic, certainly modifying as they had to when large groups weren't as safe and shifting to one-on-one conversations, but finding any points of decision-making opportunity for community members, whether it was about food or life, daily life. You know, there were certainly restrictions that none of us had much control over, but just centering the people at the beginning and continuing that throughout the pandemic, I think is a really beautiful example from a community.
Thank you. What else do we have?
I guess share just a couple of international successes. There's plenty here too that I've heard about, but just to kind of take it beyond the borders of the U.S., I'm working with an initiative north of the border at Schlegel Villages, and what they're doing is there has always been a crunch for long-term care beds, particularly in Ontario. often people waiting for weeks or more in the hospital because there's just no long-term care place for them to go to. And with the pandemic, and with people living with dementia coming in the hospital and being delirious or just the toxicity of a hospital environment, some of them became very distressed, did not look attractive to people who were opening up their long-term care. And some of these people, these poor people, have been in the hospital for months. A toxic environment for a person with dementia who's not acutely ill. So one thing the Schlegel Villages did was they, through a shared agreement with the ministry, they have opened up one 20-person neighborhood, and they have taken people from the hospital that nobody else would take. And this is kind of when I talk to the group about it, instead of doing like physical rehab, they're doing kind of emotional rehab, because this is a real trauma, a real PTSD type experience for these individuals. And their goal is to try to use these practices to get people back to the point where they can go to traditional long-term care and succeed. And just this week, they had their first, what I call, graduate, a gentleman who is just doing extremely well, who's going to be moving from there to traditional long-term care. People who thought nobody could ever care for in a long-term care community. The other thing I'll mention real quickly, Mercy Health in Australia gave a webinar. I think Kirsten was probably part of that because it was a global aging webinar where the CEO, Steve Cornelison, talked about how they kept visitation open during the pandemic. And they did it by, once again, challenging some of our thinking, by thinking critically and saying, a coronavirus doesn't really know whose hand it's sitting on or who's coughing it around. So why don't we hold the family members to the same standards we do the team members? And so family members had to pass competencies and instruction in infection control. They had to show that they could, don and doff the equipment. They had to shower before they came in and go straight home afterward and make appointments and meet in certain areas. And they were able to do that when nobody else was allowed in and prevent the spread of infection. So once again, some things we accept as givens, but they're givens based on our model of care. So we say, well, 2 people with COVID need to be put in a double together, but if you don't have doubles, that's not a consideration. Or if you can't cohort people, like the Greenhouse Project, but you have a household where everybody has a private room and private shower, that's less important. When you always have consistent staff and very few agency like the Greenhouse Project, those vectors for infection don't come into play. And you don't have to worry about changing your whole staffing rosters and your assignments because it's been done. So some of our wisdom around infection control is still based on the institutional model of care. And the rule book changes when the model changes.
Wow, love it. Okay.
I'd love to add just 2 quick success stories from the field. The first, we started this conversation talking about Carol Woods. So it seems nice to bookend this conversation by, again, mentioning Carol Woods. They've always been an exemplary organization with, incredible leadership with CEO Pat Sprigg, who's now retiring. She's really a living legacy in our field, I believe. And they've always been dementia inclusive ever since opening their doors in 1979. And about 2 years ago, they really renewed their commitment to supporting dementia inclusion by looking at some of their practices, organizational practices. And 2 of the practices that they really decided to strengthen just 2 years ago were dedicated assignments and having interdisciplinary neighborhood shift huddles every day, every shift, really focused on well-being, so not shift report. They were already doing that, but they really wanted to start having very intentional conversations about how to be more proactive. And when I talked to Pat and Jen at Carol Woods about their experience during the COVID pandemic, it just did my heart good to hear them talk about how powerful those 2 practices have been in supporting their community and navigating the complexities of COVID-19. And so wonderful to hear that how well the Carol Woods community work together. And when I say community, I don't just mean the employee care partners. Their community worked together. The residents were engaged in the conversations, the family care partners, all of the employee care partners. And so they're just a great success story about a community that leaned into person and relationship-centered approaches to navigate this issue and emerged stronger as a result. So I think that is a success story, and we encourage folks to reach out to our friends at Carrollwood sometime to learn more. But the other just brief success story I want to share is from my state of Nevada. And when the pandemic hit, my colleagues and I were really concerned about what would happen to older adults, understanding their increased risk for developing severe infection and their risk of mortality. Instead of developing a pandemic response on behalf of or for older adults, instead in the state of Nevada, we partnered with older adults to develop our state's pandemic response. It was something called Nevada CAN, the Nevada COVID-19 Aging Network Rapid Response. And I know I've talked about it on Eden Live before, but I just want to mention that the elders who we partnered with to develop our statewide pandemic response were elders from dementia-friendly Nevada, elders who are living with dementia. And I just think we have to shine a light on the incredible contributions that people who are living with dementia can continue to make, not just in their own lives or in the lives of their families, but in our communities and in our state and in our nation. And I really want to emphasize how grateful I am for the role that my partners who are living with dementia played during this pandemic response. And I hope that we will continue to see the engagement of people living with dementia increasingly in any change efforts focused on the well-being and quality of life of people living with dementia. Nothing about us without us. I think that's what's called for.
It's gorgeous, Jennifer. I just popped up a quote from one of my great friends and mentors, Dr. Emi Kyoto, who said, "Community is something we have to create and negotiate together, not something that can be passively received." And that's true for people with dementia as well. Absolutely.
So brilliant success stories. I do want to just highlight, I'm so glad, Jennifer, that you brought up the Nevada CAN project. For those of you who want to hear the fine points and the details about that, please go back in our archives, because you'll find that, yes, we were able to feature Jennifer's work and Peter Reed's work and their colleagues around this effort. It's quite impressive. So make sure you take some time to check that out, because there's a lot of great stepping stones from what they achieved and what they learned from that process that you could benefit from. So with that, we're kind of coming to the close of our time together today. I just want to say this was brilliant. I'm sad that we didn't have anybody pop anything into the question box, but we obviously had plenty to talk about. And I appreciate all of the brilliant responses and the rich feedback that you offer everyone out there who might have these questions.
Thank you. Such a treat.
Yeah, thanks. It's a pleasure.
Always a treat to hang out with you guys.
Thank you.
All right.